The Coordinating Minister of Economic Affairs announced the contribution subsidies to BPJ's JKK and JKM schemes for ojol drivers. But what is contribution subsidy? Thank you very much for watching every time, everyone. My name is Ippei Tsuruga, International Labour Organizations. I'd like to explain what is contribution subsidies in the Indonesian context. Maybe it's good to take an example from JKN, Social Health Insurance Program. It's called PBE. There were 281 million population, and the Indonesian government used to claim they had almost universal coverage. They actually used the figure 267 million participants in JKN scheme. That represents 95% of the whole population. But here is a question: what is the composition of 267 million people? If we divide into two, active participants and inactive participants. Active participants means those who are currently protected. So if they go to the hospital, they will receive free services according to the JKN regulations. Inactive participants were used to be the member of JKN, but if they go to the hospital now, their membership already expired. So they cannot receive a JKN services for free. According to the health statistics, which is available publicly, I think they first time disclosed the information about this breakdown in 2023. I was a bit surprised because I thought 267 million was the number who are currently protected. But actually that was not true. Active members who are currently covered was 213 million. And inactive members were 54 million. In total, 267 million. So that means only 76% of the whole population were protected. Internationally, we normally refer to this figure when we talk about universal health coverage, because these people are actually covered today. So if they go to the hospital, they can get the benefit. But these people, 54 million people, cannot receive the benefits if they go to the hospital. So we don't include these people as part of the universal health coverage discussions usually. Now we need to look at the composition of 213 million active participants. What are the composition of these members? 139 million people were covered by PBE JKN. That means these people didn't pay contributions, but they were benefiting health coverage for free as part of a JKN scheme. That consists of 97 million people covered by the state budget, APBN, 42 million people covered by the provincial state budget, APBD. In total, 139 million members were covered by the state budget tax-funded program called PBE JKN. So the states and the provincial governments were paying contributions to JKN fund under the BPJS Kesehatan on behalf of their members. So that means 65% of JKN members were covered by the state budgets, central budget and local government budget. They were not paying contributions. So the majority of Indonesian people under the JKN schemes were not paying contributions. So that is the reality of universal health coverage in Indonesia. And then we want to look also at the other people, the difference here. So there are certainly 35% of JKN members were paying contributions to JKN. So they were not PBE members, but they were the actual members who were contributing to the JKN funds. If we break down, there were 75 million active members who are paying contributions. That represents 35% of JKN members. If we break down PU, Pekerja Penerima UPA, who receive salaries from the companies and employers, who mostly likely working in companies, offices, factories, and they receive regular wage every month. There were 54 million PU members. Self-employed, bukan penerima upah, 60 million who were paying contributions. Another category is people out of the labor market, called BEU, 5 million. So in total, 75 million people were paying contributions. People who were not working but paying contributions, likely, probably, the dependents of PEU. Employees pay contributions on behalf of their spouse. Probably, that's my guess. There is no official data available. Among BPU, there are 70 million active and inactive BPU members registered in JKN BPJS Kesehatan. So that means the difference here, 54 million BPU used to be the member of JKN BPJS Kesehatan, but no longer continuing their membership. Or probably they were the PBE JKN members, but they couldn't continue paying contributions when the government stopped subsidies. So the massive populations stopped their membership or forced to stop the membership because of discontinuation of the state contribution subsidies program, or they cannot afford to pay contributions. JKN had 267 million active and inactive membership, and this is a volume zone who discontinued the membership. In summary, out of 281 million populations, 49% of the whole populations are enrolled in BPJS Kesehatan program through PBE JKN program, fully subsidized by the tax-funded state budget. 27% of the whole populations are actually paying contributions every month to BPJS Kesehatan program so that they are covered. 24% of the whole populations are not covered because they are not selected by the government as poor households or vulnerable households to be entitled to PBE JKN, or they cannot afford to pay contributions, so they are not covered by the program. The role of PBE is to provide subsidies to the people so that people can enjoy the benefits even though they cannot afford to pay. However, as you see, half of the populations are relying on the state subsidies program. So they are not actually paying a health insurance program, but they are still receiving the same benefits from JKN. That is the reality. But as I explained, once the government stops subsidies, just like a BPU figures, people are easily out of the coverage. They become inactive members because they cannot continue paying contributions themselves, or they may not have a culture to pay contributions, but they may have to rely on the state budget to enroll themselves in the JKN program. So there are a lot of combined factors. Of course, there are pros and cons. But on the good side, if the states provide subsidies program, the Social Security program can have close to universal coverage. On the negative side, when the state stops subsidizing, many people may be out of the coverage. First, they may not be able to pay contributions. Second, they may not feel it is necessary for them to continue paying, lack of awareness. Third, they may not have a culture to pay contributions for the insurance program to prepare for the rainy day. So providing state subsidies to the contributions, people may not change behavior, may not change culture, but may rely on state's proactive approach to the people to provide benefits. People are not sure if they are covered by PBE program or not. That is a state decision, whether or not they will target these people. You will not be able to know in advance. You'll be selected next year or 2 years later, but the state will decide who to be subsidized in the future. If people want to have a control on the program, the number of people who are paying contribution should be increased. But how? Maybe it's good to start by subsidies, but how can the government provide educational opportunity for people to understand what is the insurance principle? You may have to pay in advance for rainy day yourself. That is the insurance concept. But if the government keep providing subsidies using state budgets for the insurance program, can people learn what is insurance? Can people expect they will be targeted again next year? Can they plan for the future if people rely on PBE program in the future? And who are paying PBE? That is the state budget. Who are paying the state budget? The people of Indonesia. So anyway, people in these countries are paying for others. So this is not the program free of charge. People in these countries are paying to the other people who were selected by the government. This is the nature of a PBE program. So there are pros and cons. It can cover the massive population if the government allocates budget. Negative side, people may not have opportunity to learn the concept of insurance. So would it be sustainable or not? Please think about it.